Good evening, and I am just so excited that you guys is, willingness to learn. And I want you to imagine, you've just graduated from college after 10 years, and you settled down with all those loans. But, through grueling hard work, you've actually now opened your first outpatient counseling office. And you're excited because by the grace of God, you're actually getting clients. But it's here that you quickly learn that you're responsible for everything. That includes, advertising. How people are going to know about your great counseling services. And you're also responsible to do your own billing. Now, in my 18 years of direct clinical practice, the number one question that clients ask me is, do you take my insurance? And, you have to understand that in today's economy, a lot of people struggle. And so it's actually financially beneficial for them to have some type of insurance. And it's actually going to be financially beneficial for you too as well. And so we're going to talk about today one thing that is crucial. When it comes to getting, paid for the services that you do, you want to make sure that you're putting in what you need to. Because we have to understand in this day and age that things are very, very expensive. But of course, you're going to do a good service, but you want to get paid right for what you do. And so we have to understand, though, what's important. Why you're asking, why do I need to know this? Why is this important? 1 in 5 claims are denied. And so that means 1, 2, 3, 4. You're not getting paid. And I don't know about you, I want to get paid, but this is important because according to national studies, $12.5 billion is lost because of denied claims. Can anybody, I want some of that money. What about you? Yeah. And so today, like I said, we're going to be talking about some of the things that you need to do, because how can you not end up being that one that gets their claims denied? And so you've got to think about what you need to get approved. And so we're going to talk about some of those things today. Now, some of the objectives that we're going to go over today is 1, you're going to actually demonstrate completing a psychosocial form. Because what's important is understand that the form is pretty straightforward. However, what matters is what you put in it. A second objective is also you're going to be able to identify the information needed that you need to actually complete the form so you can be sure that you get reimbursed. Because again, you want to get paid. You don't want your claims to be denied. And also, you want to obtain and analyze the result. You're going to be obtaining information from some case studies, and then you're going to actually analyze it, and then you're going to come to determination whether or not you can treat them in your own office where you can benefit, getting reimbursed, or if you will have to refer them out. So what do all of these companies have in common?
Sell insurance. Healthcare.
Mm-hmm. Yeah, they're healthcare companies. They're insurance companies. And so one thing that they're going to ask for you when you file for your claims is this. Does the client meet medical necessity? So tell me, what does medical necessity mean?
Was it necessary for them to have that particular service?
Okay. Anyone else have any other thoughts? Yeah. Okay, so at the core of medical necessity is, does what the person come with to your office, present with symptoms and clinical, meet the severity and intensity of what you're offering for the level of care that you're going to be doing? And so you want to make sure that that is true. Again, medical necessity is about being sure that what's the appropriate treatments for the appropriate problem they're presenting with. Because what do you think are some problems with if a person admitted to some level of care and it was not appropriate?
Fraud.
Say it again?
Fraud.
Yeah. Mm-hmm. Fraud, most definitely. Yeah, and sometimes harm to the person. You have to think about that. A lot of times For instance, an example would be mental health residential for adolescents. People don't realize that research shows that unless technically that's the last resort, like they've tried everything else, putting an adolescent into a residential can be harmful because you're putting them in with other kids who are more serious. This kid may have a little bit of behavior problems, however, they're putting in here with serious, kids with serious problems, and can do damage to them. And so, for example, here's an example. There's a person comes to a doctor's office and they're complaining of coughing and sneezing. And, the doctor examines them, they take their vitals, they come out normal. There's really no other symptoms besides, coughing and sneezing, a little headache. And per this person's history, they have seasonal allergies. But because of the flu epidemic that's really going around, people dying, right, from this flu, the doctor gets scared and actually puts that person in the hospital. Do you guys think that was medically necessary?
No, not at all.
I got a resounding no. and why not? What makes you think that?
The vitals were good. The vitals were good. I mean, and just a little sneezing and coughing doesn't warrant being hospitalized.
And medical history shows they often have those symptoms.
Oh, we have to see some.
Yeah, I guess that's the case. We'd all have to be in the hospital, right? Yeah, so again, that's the core medical necessity is, the symptoms, everything, the history, all of that goes in play of determining whether or not that person needs to be hospitalized. And so how we address this, how we figure out if a person comes to your office and presents to you and tells you their symptoms and their stories, whether or not you can treat them as a clinician or if you need to refer them out, is to do an assessment. And the most common assessment in the mental health world is the biopsychosocial assessment. Okay? And so the assessment is made up of 3 parts, and this first part is the biological. And so we're talking about the body, your physical body, diseases that affect us, medications that affect us. We get side effects and things like that. And so biological, so when you're assessing someone, you're going to be asking them questions, medical history, what's going on with them medically, organic, some use that term, organic. And so the next section would be social. Friends, family, job, your interactions with people. Yeah. And so you're going to be assessing how are those interactions. Is the person going to work? Are they hanging out? Yeah. And so social and peers. And then this last section is the psychology, the psychiatric part. And you're thinking about your thoughts, your emotions, your temperament. These things, again, are inside, And now we know we actually have research now that they can do scans of the brain called SPECT imaging, where they can actually see the difference in the interactions in the brain from a person like bipolar or anything else, depression. They can see where there's different parts of the brain that are activating or not activating compared to a person who does not have the disorder. So these diseases are real. They're physical, emotional, they affect everything. And so all 3 of these sections combine into what we consider mental health. Mental health, what's going on, in all of those areas. And we have to understand that even though they're separate sections, they all combine. So that means if one is affected, all are affected. And so that's something to keep in mind when you're doing the assessment. And so we're going to talk about when a person's mental status is stable and normal. What do you guys define as normal? What's normal living or normal activities?
I think it should be fine.
You can
They're going to work.
Yeah.
They
Eating,
eating,
your meals,
eating, getting enough rest.
Yeah, normal.
Social activities, going out to dinner or going out with friends, going to church.
Okay, so those all things are normal activities. However, when a person's mental status is unstable, then their life is not normal. They're not doing those things. They're not going to church. They're not going to work. They're not changing their clothes. I mean, they just, all kinds of different things are going on. And so when it comes to insurance companies and filing your claims, they actually do things based on the diagnosis. Again, mental health, that would be things like depression, bipolar, schizophrenia, the mental health side, and then chemical dependency, dealing with alcoholism, abuse of opiates, Xanax, things of that sort. And sometimes clients will come to your office and they have problems with both. And so it's important that what it is going to decide if you can treat them, again, is the severity of the illness. Like this little picture I fit. Are they coming up here and there's all, anxious and visibly shaky and things of that sort? You're going to get all kinds of different clients in your office. And so you have to assess the symptoms. What's the severity? What is the intensity, frequency of the symptoms? So you can decide on your clinical judgment whether or not you can treat that client appropriately. Okay, because 1 in 5 people in America suffer from some form of mental illness. And so what do you guys think are some of the most common mental illness diagnoses?
Depression.
Depression. Anxiety. ADHD. Grief. Yeah.
Mood disorders.
Yeah, these fall under what's called mood disorders. These are the most common top 3 that people suffer from: depression, bipolar, anxiety. And so when we're thinking about, when we are doing assessments, I mentioned, you're going to want, I told you I'm going to tell you something that was a key thing for you when you are filing those claims, to be sure that you're going to get reimbursed. And that is risk of harm. That is the key information that insurance companies are going to be looking for when you're, applying and trying to get repaid. And so when you think about risk of harm, you're going to understand that you're going to be assessing that. Does this person's symptoms meet what I'm trying to do for them? Okay? So first we're going to actually break down some of the symptoms for outpatient. So outpatient mental health symptoms, what do you guys think are some symptoms for that you could treat on an outpatient basis?
ADHD.
Okay.
Anxiety, you can treat depression.
So anxiety, depression.
I mean, you can treat
Bipolar.
level.
Yeah,
there's
Yeah, so all of those things are correct. Again, it depends on the severity. And so the key word here is low risk of harm. So that means the person may be depressed. They may be anxious. They may not be sleeping or eating. But they're going to work and doing other things. And so, again, you could treat them in your office and with those symptoms. Okay, let's talk about inpatient mental health symptoms. So what would be some symptoms that you think you would need to actually be hospitalized for? Talk about mental health.
If you're going to harm yourself or someone else.
Okay, so again, that's the harm. Suicidal, homicidal, severely psychotic, not doing their activities of daily living, not sleeping, not eating, not changing clothes, not doing nothing, but just sitting around, contemplating things, ways to kill themselves, things like that. So most definitely, so that key word is high risk of harm. Okay. All right, so just remember that these clients are going to be in your office, and it's going to be your job to actually assess them and to determine whether or not you can safely treat them in your outpatient office. Okay? All right, so we're going to actually watch a short film on an assessment. So let me go, if you can hit the light so you guys can see it.
Well, I'm really glad that you came in today, and it takes a lot to really come to a first appointment. Yeah, you always sound like, yeah, it did.
Yeah, it's a little rough.
Yeah, it's a lot of courage. And so I want to let you know kind of what you've got yourself into here. So what we're going to do today us to get to know you the best we can. So I just want to get a glimpse of what it's like to be in your shoes.
Okay.
And so what we're going to do is work on your assessment together, because I want to learn about your story. It's not my story. And so we are going to use the computer so that I can kind of make sure we get to everything. And so I'll type as you talk, but I'm going to type in your words the best I can. And so you are welcome to just get right up to this computer and say, oh, that's not exactly what I said, but I'm going to do my best to capture what you say, but feel free to correct me at any time.
Definitely, yeah.
And if you have any questions like, well, why are you asking me that?
Yeah.
Feel free to just stop me and ask about that.
Okay.
And I know this can sometimes be hard, and it can bring up a lot of emotions or difficult thoughts. And so if I notice that maybe you're getting activated, I might invite us to try to do some skills together to bring things down. But you can also let me know, and I'll also stop about halfway through and just see if you want to take a break.
Okay.
But you can also let me know if you'd like to take a break.
Oh.
Does that sound all right?
Yeah,
Okay.
sounds good.
So, just to kind of start with, tell me about why now? What brought you in today?
Just having a lot of like stress and I think like anxiety. Not really sure, but I just know I have a lot of stress. And, so just recommended it'd be good to talk to a counselor.
Okay.
So,
And when did this start?
probably like 3 weeks ago.
So just pretty recent here.
Yeah.
Yeah. Have you ever had a time like this before?
Maybe about a year ago. When I was like finishing up school and going to other schools, and so it was pretty stressful and not really how to handle that. So.
Mm-hmm. And what really helped a year ago? Do you remember?
I don't. Maybe just talking to friends, and that's about all I can remember. Yeah.
Yeah, but talking to friends seems like it might have been helpful then.
Yeah.
Okay. So about 3 weeks ago, what let you know that you were starting to have that stress and that anxiety?
I think like interactions with my family and other people, I got like really like stressed and maybe lashed out a little bit, and I realized that wasn't like me, and I think I was just stressed out and overreacting to situations.
So you really having kind of a short fuse.
Yeah.
Yeah. Okay. Were they surprised?
Yes and no. I think they kind of know I get like that when I'm stressed, like really stressed, but also it wasn't really okay, so I think so.
Okay. Okay. Thanks for sharing that with me. Okay. Can you tell me how your sleep is?
Well, because I have a lot of assignments and a lot of things to do, it's probably like 6 hours a night,
Mm-hmm.
so.
So 6 hours, and is that a change from what you typically get?
Well, I usually get like 8 or 7 hours of sleep, but when I have a lot of stuff, it's like 6.
Okay.
So.
And are you feeling tired?
I was earlier, but I'm feeling pretty okay now.
Okay.
All right, hit the lights again. All righty, so what do you guys think?
Low risk?
Mm-hmm.
Low risk?
Yeah, and did you see, I mean, it technically is like, like a relationship, when you're trying to start a new therapeutic relationship. And actually, Rogers, look at, his research showed that some key things in therapists is that we need to have positive, regard for our clients, unconditional positive regard. But that therapeutic alliance is crucial when you're talking with clients and doing therapy. Alrighty, so we're going to do a quick review of the form itself. And so somebody, okay, so since it's 2, one right there, pass that around. Okay, you guys are going to share because you're going to do it in group. So the first part of the form is pretty, again, simple. Demographic information, name, date of birth, language, address, things of that sort. But the part you're going to be most focused on is the bulk part, the presenting symptoms. Now, this particular form is kind of easy for you because you just got check box and you just check boxes. But a lot of forms you're gonna find, again, in different offices may have a different looking form, different ways. Sometimes they don't have check boxes. You have to fill out the information. But for you guys here, again, you get the check boxes, which is gonna help you. And so what you're gonna be doing now, and after you've seen the video, this is, you have the form, and good, you're already broken up into twos. Okay, you're gonna all each get a case. It's gonna have some clinical on it. And so you want to be sure that, again, we're gonna take this, again, 5 minutes, guys. You have 5 minutes to do this. I'm gonna each give you a case, and you're gonna actually write down and fill out the form. You can pick who's gonna do that. And you decide on, you're gonna be doing two things, filling out the actual assessment, and then you're actually going to, once you get the clinical, you're going to decide what level of care does the customer need. Can you treat them in your office, or do they need to be referred to a hospital? Okay, so 5 minutes.
We feel on this out, right? Oh, okay.
We put this name, right? This is our patient, right? Okay.
Presenting problems.
Presenting.
High pressure. Please describe the problem.
His parents less than 30.
Because it says they brought her in and she's been feeling empty.
Right. That's all right, we want to do that. Oh.
Feeling empty.
Depression, feeling empty, like life is left her behind.
Yeah, that's
3
days.
So no decreased appetite.
He's actually done some. Withdrawn for a week.
How long do you have these problems?
Yes, not they ever change.
He's very right
It's been off and on for years. Yeah, so this has been 4 years. So it didn't say.
All right, you guys got 2 more minutes.
Lack of-
Let's put something.
She's still going to work?
She's still going to work. Can't hold your those experiences with He has excessive, cause decreased appetite.
Can't sleep.
Was wringing his hands.
Feeling nervous.
Yeah.
Lack of interest, yeah.
Yeah.
Too much energy, right?
Sleep too much. Yeah, she sleep a lot.
Lost ways to die.
Well, he need no energy.
Crystal said she's sleeping more.
Poor memory.
She can have this. It's not said worthlessness, but when she says she feel like she's being left behind.
Which one?
Worthlessness.
So what made you come up with that?
Well, she said she feel like she's being left behind.
Well, that's the physical.
So. Feeling
Like the people don't
empty.
care about her?
Yeah, she was feeling empty. That's,
And she don't have that many friends depending on her mother.
Yeah.
Too much in people.
He's been charged and convicted of it.
Alright, so now with level of care, can you treat her in your outpatient office or do you think she needs to be hospitalized?
Oh, I think,
Yeah, she's been treated off.
I think it's her job.
You just don't know that. Alrighty, so, alrighty, so hopefully everybody's, I know we gotta get going.
Yeah.
Okay, so first group, who did you have?
Charles,
Okay, and what did you guys decide that he needed?
mental health inpatient,
And what was your clinical rationale for that?
risk of hurting himself as he had posted a suicide note on Facebook.
Okay, alright, and what did your group come, who did you have?
Meredith,
Okay, and what did you decide that she needed?
mental health outpatient.
Okay, and what was your clinical rationale?
Depression.
Yeah.
Just depressed? Okay,
Well, yeah, I figured it's because of her job. She case managing.
okay. Yeah, okay, and what did you guys come up with?
Okay, we had Joe, and we recommend that he is inpatient, because he is a high risk of harm to others. Cause he's having homicidal ideations, and he's even been looking up ways to kill people on the internet. And he has a history of physical violence and legal history of assault.
Alright, so again, all three of you guys, straight on. Can you quickly identify the risk of harm in each case? And most definitely the ones that need to be inpatient, again, the one that was outpatient. I always like to throw a little kicker in. Let's say I came to your office and I told you that I have thoughts of, you know what, my family would be better off without me. Do you think that I need to be hospitalized if I told you that?
Well, I asked you if you had a plan, if, you know, to
Require more prompting.
Yeah,
To
ask
see exactly what
ask
they
more
mean
questions.
by that.
Yeah.
You need to clarify, what do you mean better off? It could be better off, I'm gonna move out.
Yeah.
Right.
Better off, I'm
leave
not
the
here
town.
anymore.
Yeah.
You know, better off, I don't wanna
Cleaning
leave myself.
Yeah. Excellent. See, you guys are ready to go open your offices right now. You ask more questions.
Yes, sir.
Okay, so just real quickly, we're gonna go back over the objectives. You guys were to demonstrate doing a psychosocial. You've just done that. Identify the core information you needed to know if you could treat them in your office or not. And also obtain and analyze the results, which you guys all did. So congratulations. And so right now, again, when you think about it, how comfortable you think you are with doing this assessment?
very comfortable.
Okay? Yeah, it's pretty simple. You just have to ask the questions and use your clinical judgment.
Yes.
All right, well, thank you.
Thank you.
Thank
I think it's good.
Tuesday, I was on Facebook.